Good morning, everyone. Elkin family. And I'm very happy and pleased to be here to share the journey that started in 1999 in a small city in Scotland, Aberdeen, and then it moved to Oslo, and still part of the research going on in Aberdeen that actually testimony to the properties that is being attributed to the humble tomato, but it is no more humble. It's a very powerful and kind of an alternative to the modern medicine, and as a most important preventive of cardiovascular disease. Cardiovascular disease is a #1 killer in the world. Still, there is a lot of medicine has been discovered and being used, like antistatin, against hypertension, and so many things. But still, it is a major concern for different countries with a different background, whether it is a cold country, Norway, or it is a very hot country like Malaysia and India. It's a major common problem. How can we deal with it? It is not only killing people prematurely, it is making people unable to work. It is against the human rights of the people's right to work properly and contribute as long as they can. So today I'll be talking our journey with tomato and how it become a big functional food that can be used or being used as a preventive of cardiovascular disease. And I work, as you know, in Norway. It's a very harsh weather in winter and little bit summer we have, 3-4 days, but mostly it's winter. And people are stressed when there is a snowfall. And we noted that platelet become very hyperactive on the day 1 of the snow and can have a lot of cardiac events. That actually is a testimony that importance of platelet. Anyway, I'll not go too much in details. I'll start talking now. In the cardiovascular disease, as I mentioned, there are a lot of regime in modern medicine have been being used, but still we have a problem. And if you look at this cartoon, still there is 50% we don't know why it is happening. You will find a lot of people having quite a so-called healthy biomarkers. Absence of disease does not tell you that you are healthy. A lot of things going on in the body which is not detectable yet by the present day invention of different diagnostic marker. But still we use some of the marker like, we know that if we get old, then there is a chance of cardiovascular disease. Male gender, it was written 20 years back, it is no more true. Male and female, they are equally kind of a victim of cardiovascular disease. Before, in the hospital, the women's symptoms are a little bit different. Their chest pain is not that intense, so it was neglected, but we now know they are as victim as male. And family history, and of course, the clinical diagnosis like high blood pressure, high blood cholesterol, diabetes, are the known causative factors to develop cardiovascular disease. But still there is unknown causes are more than 50%. You will find sudden death in very highly active life people like sportsmen, and also people having a normal, so-called normal risk factor, but still they are dying of cardiovascular disease. Why? Because of lack of knowledge, because of lack of risk factor we don't know, and because we did not go further enough, earlier stages where you can detect the disease, who will develop the disease and who will not develop the disease. That is still being developed. As you see in this slide, that you know that hypercholesterolemia, if you have a plasma lipids and plasma cholesterol, this is a risk factor. And if you have a symptom with chest pain and non-chest pain, but if you have a high cholesterol, then you go to the doctor and he will prescribe statin, right? The cholesterol lowering drugs. But if you look at this situation, that this is the total serum cholesterol versus percents of population with myocardial infarction and without myocardial infarction. They have the similar cholesterol level. So then you can ask me, what is the point to use statin? That depends on the country you live in, the food behavior you have. If you go to Greece, those who are having a lot of fruits and vegetables, they smoke, they have a big tummy, they don't have cardiovascular problem with even high cholesterol level. But if you go to America, this sort of cholesterol level will definitely precipitate to cardiovascular disease. So there are maybe so many other factors. It is not the factor. And we treat people, cardiovascular patient, generally with 3 or 2 medicine. One is lowering blood pressure, another is lowering cholesterol level. But still people having a problem. And it is actually, that starts very early, the cardiovascular disease. Early means that, say for example, the hypercholesterolemia, and we know that the level of LDL, HDL cholesterol should be, normal situation should be like this within these 2 lines. Say for blood pressure, one should have 120 versus 180, and they should maintain according with aging, so that if you maintain that levels, then you have healthy aging, right? But if this level goes up, 130, 140, 160 like this, then there is, at this stage, you must not have much option, only to go for pharmacological option, that is to treat the blood pressure by using different kind of blood pressure medicine. But modern day medicine is saying that these factors, the high level of cholesterol or high blood pressure, whether it is a cause or the result of the disease, that is still a big debate. And that actually, it did not start right away, just yesterday. It has been going on long time. So as a nutritionist, these factors have an origin maybe here, much earlier in the life. And that may be contributing, slowly developing the diagnostic marker. Then when you have a very high level, then we don't have many options except a pharmaceutical option. But as a company like you, that is looking for holistic approach to the disease, we have to look for the marker very earlier on, so that nobody develops that kind of biomarker at that level. They maintain that values within the dotted line. That is called healthy aging. That means with the age, we don't change the marker, so it goes to the disease marker level. This is one of the marker, but the cardiovascular health actually is a very complicated. What is main function of the blood is to maintain its fluidity, its liquid, so that it can take the nutrition to the different tissues. The brain is the most important one, of course. You cannot live without 1 second, without oxygen, and blood actually flow through the carotid artery is the most important. So the flow of blood is most important aspect in the cardiovascular disease. And all the tissues, they need blood for nutrition, oxygen, etc., etc. And also removing all the debris and the leftover products. That is, all the tissues are producing, bringing back to the lungs or kidney or urine or whatever to get rid of it. And this process of renewing ourselves every day, blood is the traveling story of human body. And blood flow is the most important aspect in order to survive and renew ourselves every day. Millions of liters of blood actually all the time. Although it is 5 liters, but if you think about the total flow, it's very important. And we have a big artery, small artery, veins, and microvascular things, so blood has to go everywhere in order to maintain the tissue, in order to take over the raw materials and regenerate ourselves so that we become vital, energetic, and working very well. So the blood flow is the most important aspect of cardiovascular things, plus including the memory and brain activity. Brain depends on the blood because they cannot store the energy. They depends on the ready supply of glucose. And if the glucose is not there, we'll be in coma. So you can imagine the importance of blood flow in maintaining our body and with proper cognition or memory, etc., etc. And these things actually has no much symptomatic because there is no symptom. High blood pressure, you see, it happens here, but the blood flow can be affected very earlier on. So what are the factors that actually responsible for the blood flow? Then I will introduce the platelet story. The platelets are another blood cells. They don't have nucleus. We have 10 billion platelets roaming around the body in the blood, and its main job to maintain the pipe system all right. The pipe or drain system that is pushing the blood to the body by the heart and bringing the waste product through the deoxygenated blood. And this arterial system or venous system, the integrity, shininess, and proper flow to maintain, the only cells in the body that look after this vascular system is platelet. But platelet is another job, important job, that is to maintain the integrity of the vessel wall. If you cut your vessel by injury or anything, then the platelet will rush there. In a normal situation, the blood flow is going on, platelet is very shiny. It does not touch the artery, you know. This is a membrane, internal membrane, endothelium, and underneath is a smooth muscle cell. But in a normal situation, platelet moves with other blood cells. They don't touch. But it looks after any problems if there is a roughness on the surface, or if there is a discontinuity if you cut your vessel wall, then all the platelets will come and rush there. They think it's my job to stop the blood flow, because internal bleeding or external bleeding is dangerous. That's why nature created these cells, not only monitoring the integrity of the vessel wall, but if there is a need, if there is a broken vessel wall, all the platelet will aggregate and rush there and make a plug, so that no blood cannot come out of the system. Because if we lose the blood, then we lose the blood pressure, and then we'll die. So this is a very important thing. So there are two jobs of platelet. One is to maintain and oversee the integrity of the vessel wall, so the blood flow can go on, and blood flow is important. Other thing is to maintain the plug, and it's very important so that we don't lose the blood if we by chance cut our vessel wall or something. Or in surgery, you need to stop the blood flow internally, etc. So platelet is the major cell. But blood flow is important for our situation, because as you're sitting, you're talking and all these things, the blood flow should maintain so that the energy is going everywhere, your brain is working, they need a lot of energy, a lot of oxygens, 20% that we take, and that all depends on the blood flow. Because blood flow against the gravity, through the gravity, depends on the situation. If you're lying down and all of a sudden wake up, then it's orthostatic pressure, then blood has to flow to the brain against the gravity. So it's so important. With the millisecond it happens. If it does not happen, you will feel dizziness. Okay? So blood flow and oxygen is very important. But that can only happen, as I'm telling, if your arterial system, the drain system, vascular network, where the blood flows, artery and veins, are clean enough. No bump on the road. Okay? The surface must be safe. But these are the molecules. It is very important molecules. They are buried under the endothelium. They don't express. Because if they come out or pops up on the road, then they will bind the platelet. And it is required in the case when you have a vascular injury. Then endothelium is gone. These molecules comes out and they will bind the platelet so that platelet can aggregate at that place. But this thing happen also if your artery is damaged. Damaged by what? Damaged by smoking, damaged by bad food, more fat, unsaturated fat, and sitting there long time and aging, and in diabetes, insulin resistance. Under all these conditions, your artery or vein, actually this molecule pops up. This is damaged, or this is not functional, or inflammatory disorder, or under oxidative stress, this molecule actually, and then they bind the platelet. The platelet rolling is disturbed, is reduced. And blood is a thixotropic fluid. If its velocity is decreased, then its density will be increased. And density increase means what? All the cells will be localized there. And then platelet become activated. It will secrete so many molecules, and that will activate the endothelium more and more. And then you have a debris there, platelet aggregation, molecule, monocyte, macrophage, fat, and they will accumulate there and produce bump, what we call atherosclerotic plaque. Everyone has plaque of different size and different places, including newborn babies. Those babies born of diabetic mother or obese mother, there is a study in Italy showed that babies after their cot death, there is a plaque already. So this is a lifelong processes. And platelet hyperactivity is also happening with everybody. And I'll talk later on, not now. So one thing more, if this is a cartoon, I just made it two half. And see, this is an arterial or pipe system where the blood flows. And if you have a shiny endothelium surface that is in an ideal condition, then you have a lot of receptors there. You don't need to understand, but only you can see this receptor can produce nitric oxide. If you have a arginine in the system, the amino acid in the protein, or other things that will relax the blood pressure. Vessel relaxation and lower the blood pressure. If you have a damaged endothelium, then it will not work through this receptor with some other receptor. And they will produce ATP, ADP, and that will activate the sympathetic nervous system and produce vasoconstriction. You can see if the vessel wall is damaged, and then that will produce vasoconstriction. And what that means is constriction of vessel wall. That means hypertension. Blood pressure will be increased. And this is mediated by platelets. And there is no medicine yet today which actually take care of the platelet-mediated increase in blood pressure. Some people may take a lot of multiple blood pressure medicine, say using calcium blocker, beta blocker, AC, but still there will be some residual high blood pressure if the artery is damaged or vein is damaged, and this is because of vasoconstriction. But if you have a smooth vessel wall, then this thing produce all these nice factors, prostacyclin, nitric oxide, etc., that will relax the blood pressure, vessel relaxation, and blood pressure will be maintained. So you can see the importance not to have plaque. Who is producing plaques? As I mentioned, hyperactive platelets, they secrete the molecules, inflammatory cytokines, platelet membrane factors, and some other factors that I'll come with the next slide, that producing a situation which activate vessel wall, the tubes, and the tube get bump or increase in the situation and narrowing of the artery, and then the blood flow will be reduced, and high blood pressure can be the cause also. And this can happen in a non-clinical setup. That means these are no symptoms, but it is happening in the body. Insulin resistant, that means some people producing insulin is not working properly, but you are not diabetic. But they having the same damage as the people with diabetes because they are activating the platelets. And under this condition, in diabetes mellitus, insulin resistance, if somebody is obese, aging, bad diets, a lot of saturated fat, sedentary lifestyle, not much working, and sitting there long time in the office, and leg is not really working, and pollution. That is also very important contributing factors to have the cardiovascular problem. Oxidative stress, you are not eating too much fruits and vegetables, and you have less and inflammation and hyperlipidemic conditions, and some drugs can activate oxidative stress. Lot of drugs has lot of side effects, and that also contraceptive also there. And cancer, people die because of hyperplatelet activity, not because of cancer. You will find that at the end point is a cardiac death, is not the cancer itself, because of hyperactivity of platelet and blood coagulation activation. And exercise itself is producing insult in the body that actually activate the vessel wall. But what can we do? There is only antiplatelet drug is available, even today, is aspirin, and other is clopidogrel and others, but they cannot be used for this sort of people as a primary preventive, because aspirin has a lot of side effects. And also, I'll come later on. Okay, just to tell you that in the traffic-related pollution, DVT, deep vein thrombosis, the clot in the leg, and that it can come to the lung, it can go to the brain, and can produce stroke and things like that. And it is shown very clearly in a hyper-polluted country or city, there is a lot of hyperplatelet activity, and that produce the DVT and sudden death. And you see here, this is to show you that the platelet become hyperactive by diesel exhaust itself. Even you have a good body and things like that, but transiently platelet can be activated by the diesel exhaust. The data is here. And that is the mechanism. The particle the size is 2.5 micron. It can go to the lung and can produce cardiovascular disease by oxidative stress and by hyperactivity of platelets and other things. So I'll not talk too much. And this particle membrane can also, air pollution can also increase the stroke possibility through activation of the platelets. And also the exercise itself. So there are a lot of factors, plus these lifestyle factors that can actually release thrombin, that I'll come later on, and adrenaline in the circulation that cause inflammatory stress and can activate the platelets. And platelet activation can lead to plaque formation and ultimately cardiovascular problem. And this is the mechanism by which the exercise itself can produce this sort of platelet leukocyte aggregates and ultimately inflammatory cytokine secretion and can activate the endothelium of the network, of the vascular network. And this slide showing that exercise, whatever level you do, there is always involved platelet activation. And what that means, that the extent of inflammation depends on the vascular endothelium function. If your endothelium function is not right, then there could be a big problem. And there is a possibility that sudden death of 50-fold greater, those who are exercising because of platelet activation, and there is 100-fold greater in myocardial infarction because simple transient activation of the platelet. So far I mentioned that hyperactivity of the platelet that we see in the lifestyles, like in smoking, high-fat diets, exercise, pollution, and disease like diabetes and etc., that can lead to platelet hyperactivity, and that will help to have more atherosclerotic plaque, and that plaque, if it is broken, can lead to cardiovascular death or cardiovascular event like stroke, myocardial infarction, and things like that. So it seems like that platelet hyperactivity, that is can happening in the normal population or so-called healthy population, no biomarker for that, but that ultimately producing the cardiovascular situation. And people with this sort of lifestyle, they don't have any alternative. The alternative available is, okay, and this just I will to tell you that when platelet become active, they release that sort of products, and that lead to all sorts of cardiovascular problem. And this hyperactivity of platelet actually can happen under this condition. So one is not diseased yet, but they have a situation like this where platelet is activating, and producing this sort of conditions. Okay, I'll not go details in that. So far, if I summarize whatever I say so far, all this lifestyle that I mentioned that can lead to platelet hyperactivity, and then platelet produce so many things that actually activate the endothelium, the network, or the vascular network, then ultimately lead to atherosclerotic situation. And if the plaque is broken, that leads to CVD events, and platelet also involved at the penultimate of this situation. The question is here that aspirin is given to all the CVD patient, those who have already went for bypass and stent, etc., as a secondary prevention. Because, okay, before I go there, just to give you a little bit flavor, what is platelet? Platelet is produced in the bone marrow. And we have every day we produce 10% new platelets. And these are coming from megakaryocytes. It does not have any nucleus. So it cannot replenish its protein. So once protein is modified by aspirin, its whole life it cannot aggregate. That means if you take aspirin, if you need a surgery within 10 days, you cannot do it because platelets simply will not aggregate. And the platelet aggregation is important for stopping the bleeding after surgery. So that's why doctors always ask you whether did you take aspirin or not. Okay? And another thing is that aspirin works through the arachidonic acid modification by thromboxane A2, then it is responsible for aggregation of platelets. But thrombin, when we have a plaque is broken, the thrombin comes into play. And thrombin can aggregate the platelet without thromboxane A2. That means if someone is taking aspirin, tons of aspirin, but he is not protected from the major event when thrombin comes into play, when the plaque is broken. So you see there is a negative thing about the aspirin. It is good in certain extent against the collagen, epinephrine, etc., but is not good at all against thrombin. But thrombin is the major killer. So this is, and also as 30% of us are resistant to aspirin, it simply doesn't work. But all the cardiovascular patient is getting aspirin along with other antiplatelet drug, but they are not followed up. Survival is not that good, but there is no other choice. No drug is available. And as of today, there are 5-6 drugs are used as antiplatelet. Aspirin is the major one. Clopidogrel and ticlopidine, they are used in combination in order to make sure they don't get aggregate. Especially those are used as a secondary prevention, as I mentioned, those who went for cardiovascular surgery or having a bypass or stent, they have to stop it, so they use these things. But when it comes to mortality, it is not very effective. As I mentioned, thrombin is the killer when the cardiac event happens, and aspirin cannot do much because thrombin itself can aggregate the platelet. And it has side effects. That's why American FDA, they said that although platelet is hyperactive, as I mentioned under this condition, but you cannot use aspirin because of its side effect, gastric bleeding, and 30% are aspirin resistant and ineffective in a lot of conditions. So what should we do? I'm talking of millions of people. Those are not yet having cardiovascular disease, but their platelet is hyperactive, according to our study and other study, under the conditions like obesity, under the condition like diabetes, under the condition you are sitting long time, under the condition you are flying from here to America, long flight, sitting there, and then you develop DVT. You can take aspirin for 1 or 2 days, but you cannot take regularly because of gastric problems and other problems. So I was looking for whether there is anything aspirin replacement is available in the nature. There is an epidemiological study showed that the consumption of fruits and vegetables is inversely related to the CVD and cancer and other sort of things. Because if you take more of these fruits and vegetables, then the CVD incidence is less. This is an epidemiological study. It's an empirical relationship, but there is no cause and effect. but it is the observation. And vegetarian people have less. It is not also true. Because if you go to India, those who use a lot of ghee and dalda and all sorts of things, they have a lot of problem with CVD. So even fruits, vegetables cannot protect that because they have other kind of problems. But one thing is sure, that if you are vegetarian, you take less of saturated fat. Because of that, you get the benefit. Or there is some compounds in fruits and vegetables in terms of antioxidant, polyphenol, etc., that are protecting your cardiovascular system. That is the question. But my interest is to see whether there is anything that works like aspirin, is inhibiting platelet aggregation. So I did a very simple study. When I was in Aberdeen, I went to the grocery shop and brought the fruits, which is available in the market because Scotland does not produce any fruits. So they all are outside. So I use several fruits and make a juice out of it. And then isolate the blood, take the blood and isolate the platelet and added this fruit juice, 10 microliter of all these juices separately, and then aggregating agent, we put it there. And one control is no fruit juice, but the aggregating agent. That gives 100% aggregation. And if you look here, the tomato, very humble tomato, it has given 170% inhibition of platelet aggregation. And you do it here, anywhere in the world, use tomato extract, 10%, 10 microliter will inhibit platelet aggregation, whereas the other fruits has a variable activity and some has no activity. So it is not the antioxidant, it is not that we know of present in the fruits, it is something special in tomato extract which actually inhibited platelet aggregation. And this is the beginning of the journey of tomato extract, that we published the paper in 2001, we patented it, everything, and then we found that very interesting story, that tomato extract is inhibiting also thrombin-induced platelet aggregation, whereas aspirin cannot do anything. As I mentioned, the aspirin is working through thromboxane pathway, but thrombin can aggregate the platelet without involving thromboxane. And here it is showing in vitro study that tomato extract inhibiting also thrombin-induced aggregation. So it can be useful even for the patient. And not only that, it is inhibiting ADP, collagen, arachidonic acid, all aggregation, if you use different dose. So this is the first natural product which is active against multiple aggregating agent, including thrombin, whereas the aspirin is working against only arachidonic acid. It's a monospecific, and that's why it has so many failures. And also, 30% people are resistant. So this is a not only better replacement, it is giving you more protection, like an umbrella, against several aggregating agents that can come play in a given one time. ADP, collagen, etc., etc. And most importantly, against the thrombin. Now, question is where it is. Because you know tomato and lycopene is a very synonymous thing. But lycopene has no platelet, antiplatelet activity. And this extract that we developed, it is present in the yellow fluid around the seed. Highly water soluble, molecular weight is less than 1000 Dalton, and is very stable, it can stay longer time, and it is not present much in the skin. And when you make a salads, you lose the yellow fluid. So you lose these antiplatelet things, most of the salads, because you drain it out. So it is not there much. But only if you chew tomato whole, then there's a possibility you drink or consume this compound specially present in the yellow fluid around the seed. And we did then isolate the compounds, and we did make these processes, and now we have a total active fraction is a 4% of the aqueous dry matter of the tomato are antiplatelet, having antiplatelet activity. And we did several trials, human trials, and it is showing that if you take tomato extract, then within 1 hour to 3 hours, you will see the depression of or inhibition of platelet aggregation. And this is a orange juice with tomato extract. This is with tomato extract. And without, there is no effect. So this is the in vivo human trial showing the importance or inhibition of consuming tomato extract inhibits platelets within 1.5 hours. And the activity goes on up to 24 hours if you take one capsule. And next day you have to take another one to keep it. And it does not, the dose is such, 150 milligram, so it does not go beyond 20 to 30%, because then it will be like aspirin, there will be bleeding problems. So we keep and maintain the 70% aggregation activity so that everybody is happy. Because if you take aspirin and if you cut your things, then could be huge bleeding problems. And this is highly reversible. It stays 24 hours, then you have to take again. But for aspirin, you have to wait 10 days. You are damaging irreversibly your platelet aggregation, whose main job is to see your vascularity is there or not. By taking aspirin, you are compromising this sort of activity of the platelets. So that's why FDA does not recommend people like us to take aspirin every day. In addition, it also damages our system, intestinal system, produce ulcer, etc., etc. So this is another live experiment just to show you that this is a two-chamber with a collagen-coated membrane, and these two. And the top one, no tomato extract is given with the platelet, and platelet flows there. And because of the collagen, platelet aggregates. But here they don't aggregate because the tomato extract is there. So this is a live experiment, but I fortunately cannot show the live things. But this is showing very clearly the ex vivo experiment that if somebody has a tomato extract, the platelet is inhibited, they don't aggregate. But whereas the top chamber is no tomato extract, but platelets started aggregating, as you see the white spots. Here is no aggregation. And we did several studies, 9 to 12 studies. And this is one of the study, acute study and chronic study. Two acute study I'll be talking about today. That is giving tomato extract, isolated from different amount of tomato, 2 doses, and we gave to the people. And then we take the blood at time 0 and different times, and vein flaunt is on, so that we don't need to do venipuncture all the time. And then we measure the platelet aggregation response. Another study is a chronic study. We did for 1 month and given the tomato extract every day, and then we measure platelet aggregation at every week, how it is going. And if you look at this slide, it's showing that it's tomato extract, as we expected, at the different time point, there is a very nice significant inhibition, 20 to 23%. And this is our calculation. With that dose, that equivalent to 150 milligram of tomato extract, that will not give more than 21% inhibition. That is the hyperactivity range of the platelets. Platelets are being normalized. And the control, the juice containing no tomato extract, there is no change in the platelet aggregation response. And there is a volume effect also we checked. If it is given in 50 ml volume versus 200 ml volume, and there is a big difference because 50 ml is a concentrated, they are well absorbed, then 200 ml is a big volume, so less absorbed. But nevertheless, the activity is expressed at 1.5 hours, 3 hours, 6 hours, and 24 hours. And this article is published in prestigious American Journal of Clinical Nutrition in 2006. And then we found that all these clinical studies that no effects on total clotting time. It's very important our clotting system is intact so that we don't produce bleeding disorders. And there is no effect on prothrombin time, that the extrinsic coagulation pathway, that we always check with the patient. Their system, if somebody is taking warfarin or aspirin, they are not damaging their internal aggregation or clotting systems. And we did not find, as we expected, because tomato is consumed by Hungarian people in a goulash, takes 400, 300 grams of tomato, no side effect, 100 of years. So it is there, but since it is an extract, but this extract is isolated without using any chemicals, without using any modification, is simple isolation, water soluble, by using different separating methods. So it is a very important that we did not modify anything, compounds in the tomato when we isolated this active fraction. It's very important for food industry. And this is a chronic consumption study. That's after 1 month. As you notice, there is always inhibition of platelet aggregation, whether against ADP, collagen, and also some marker, and no change in the clotting time, little bit things there. And in addition, we see there is a decrease in the plasma lipids. So people can also shed some fat in this. Okay. And this is another interesting study. I don't have time, and also it may be too complicated for you. Just to show you that, tell you that in exercise-induced platelet activation, this activation can be reduced if somebody takes tomato extract. Recovery. Because after exercise, you need to do recover. Because of you created a lot of free radicals, because of exercise, secrete some of the peptides and things like that. And if you do every day, there is a chronic exercise can have also detrimental effect in the body. So it's important to recover the system. And it seems that tomato extract is the latest data, is not published yet, but it will be published soon. Okay. And the placebo treatment, it is showing there is no change after that treadmill exercise. But if you take tomato extract, then you can lower all these things, circulating interleukin-6 and plasma thrombin generation activity. And this is the result showing that exercise plus tomato extract, there is a reduction of microparticle that I said when platelet become hyperactive, it sheds membrane, and that interacts with the vessel wall, tube network, and produce plaque. And in this situation, it is inhibited by taking tomato extract before exercise. Same is true thrombin generation time and inflammation also. So it's a very important effect of tomato extract in exercise-induced insult in the body, in the cardiovascular system. Lot of people are asking that how it compares with aspirin. We know that it inhibits thrombin-induced platelet aggregation, which aspirin does not. Aspirin can inhibit platelet aggregation for 10 days. It works through the protein, and platelet does not have a nucleus. It cannot regenerate the new proteins. So for lifetime, it becomes inactive. So it cannot do the job that it's supposed to do. As a reconnaissance flight, it should look after the integrity of the vessel wall. It cannot do it if there is a breakage or other things. It only can do, it cannot aggregate, so that it does not allow to thrombotic things happening. But it is at the cost of physiological function. The another function is that it should oversee the integrity of the vessel wall. And it cannot do if you take aspirin, because for 10 days, its lifetime, it becomes inactive. And that's why it cannot be used as a primary prevention. Because in primary situation, developing situation, the most important function of the platelet is to oversee and monitor the integrity of the vascular wall, tube work. But taking aspirin, you actually take this property from the platelet. It cannot do anything. And also 30% are resistant, and also it has other side effect, like as I mentioned, ulcer development, intestinal dysfunction, and other things. And 30% people are resistant. But here we did the study, it's just published in European Journal of Clinical Nutrition. We try to see the difference or similarity between 75 milligram of aspirin that is being used for the patient, CBD patient, daily, versus 150 milligram of tomato extract. So what we did, we keep the people up to 7 days, and they are given every day either aspirin or fruit flow or combination. And then we see at the day 1, it has a similar effect, that after 24 hours, there is a 20% reduction of platelet aggregation response as aspirin does, as tomato extract does. But after 7 days, the aspirin is accumulating. So then reduction is more than 70%. But with tomato extract, it is still 20%, because it's reversible, it does the job, it goes away. So that means this is targeting the hyperactivity of the platelet, not the physiological behavior of the platelets that aspirin does. So it clearly shows that this tomato extract can be consumed every day and you don't have more than reduction of 20%, whereas aspirin, we know that, and a lot of studies shows that it can develop up to no aggregation at all after 10 days, and it is dangerous. Because common people can have a bleeding problem, they work, they can involuntarily cut their vessel wall or something happening, and platelet has not the ability to aggregate. But the major function difference is that platelet cannot oversee our important drain system, plumbing, and seeing, and sensing, and repairing. That activity is lost if you take aspirin. And this is another thing show that is a platelet plaque formation is a normal situation. If you don't take anything, you are healthy, and all this is 50 to 100 seconds. That's called platelet analyzer that actually produce plaque. It's a physiological test, not aggregation test. And if you take tomato extract, it still maintains the same, little bit increased time. That means takes a little bit time. But with aspirin, there is a huge increase in the time. That means it's not aggregating at all. And we cannot keep people like us under this condition. Then could be bleeding problem and others. In addition to, as I mentioned, the surveying of the vascular system. Now, another thing is important because we are talking about the fruit extract, which contain a lot of antioxidant, polyphenols, etc., vitamins, etc. And we know that lowering of the blood pressure can reduce stroke and cardiovascular events. So we did recently some study with this tomato extract and find out very interesting. And we actually did another work to show that tomato extract can inhibit angiotensin converting enzymes that produce angiotensin 2 and can increase the blood pressure. That's where the drug ramipril, captopril being used in this country and everywhere in the world to inhibit the angiotensin converting enzymes. And we found that tomato extract also inhibit angiotensin converting enzymes. That I am not sure, but you can find out in PubMed and Google if you search tomato extract and angiotensin converting enzymes. So we just did some clinical study. That clinical study involving normal people, but they are obese a little bit. Means they have a heavy weight, some of them may smoke, and some have high blood pressure. As you can see, BMI is 27, and we did a random control trial. They don't know which capsule they are taking, one with tomato extract, with another is no tomato extract. And it is randomly assigned and double blind. And they took it just say for today morning and come back tomorrow. And we take the blood today, also tomorrow, to measure the platelet aggregation response. And we wrap them around 24 hours blood pressure monitoring. Because 24 hours we did, because single isolated blood pressure could be accurate, could not be accurate. When you go, it's called white coat syndrome. If you go to doctor's office, your pressure may be a little bit high. So that's why I don't believe much isolated blood pressure, unless it's done every day, same time, for a few days, then we can diagnose. So we give 24-hour blood pressure measurements, and it is the most expensive machine from NASA. We got it, and we wrap them up, and they go home and they do all the activities, whatever it is, and we monitor. Blood pressure is monitored every half an hour daytime and every 1 hour in nighttime. So what we found is very interesting. Those who got the tomato extract, 150 milligram, you see this is a tomato extract effect and this is the placebo. They get the capsule but they don't know what is there. And you see there is a reduction of both systolic and diastolic blood pressure. It's quite a significant change, even just one capsule. And sleep period also changes. The sleep period, horizontally you sleep, there is blood pressure is down, but still there is a decrease in the blood pressure, both systolic and diastolic. You know, they are significant from there to there, 130 to 117, 82 to 75, and 24 hours. If you average everything, then there is still reduction of blood pressure. So this is the first control trial, double-blinded study, is published last year, that showed that the tomato extract also reduced the blood pressure. And also platelet aggregation. You see, within 24 hours, there is a quite a reduction. This is individual data of platelet aggregation response, those who took tomato extract. So this is the latest clinical study. And if I summarize so far, this tomato extract is effective against platelet aggregation, against ADP, collagen, all sorts of things, including thrombin, which aspirin cannot do. And 97% are responsive to tomato extract in terms of platelet aggregation response, and 100% against the blood pressure lowering things. And it is effective against ACE, angiotensin converting enzyme like ramipril, and also it lower blood pressure and increase nitric oxide production or something like that. And this tomato extract is the first approved natural product in European Union by European Food Standard Agency out of hundreds of applications. Because it is backed up by science, documentation, is initial characterization, mechanistic, human trial, several human trial, is everything showing that it is there. And they allowed us to tell that it inhibits platelet aggregation, so increases or enhances the blood flow. And as I mentioned, the blood flow component was missing until very recently. It is one of the most important factor that's debilitating us in terms of energy, in terms of vitality, in terms of memory function and everything. And I'm very lucky that you people decided to include L-arginine with the tomato extract. And why it is so? Why I believe that it could be one of the most important kind of combination that tackles or prevents cardiovascular disease. Because you know that nitric oxide that is produced in the body, its life is very evanescent. It comes and goes away. But it does lot of jobs and important jobs. It relaxes the vessel wall. You can find out if you take even watermelon juice or beetroot, you can lower blood pressure instantaneously because of nitric oxide generation from arginine. And people, if they don't have a arginine in the body, then they cannot produce nitric oxide. So they need a source of arginine. Sorry. And this nitric oxide, it can come, the arginine can be from different sources, but it is not that much available. And this arginine can go different pathways. One, the most preventive and most beneficial pathway is nitric oxide production. And if there is a problem of antioxidant in the body, that's why you are adding vitamin E, etc., then arginine can go different direction and can produce problem. So it's very important that nitric oxide, sorry, I'm doing something wrong. Is it okay? Is it okay? Yeah. Okay. So this important that nitric oxide is generated in the body. But the damaged cell wall sometimes cannot produce nitric oxide. So we need to repair the damaged wall, and that can be done by tomato extract. And you have an arginine that can produce nitric oxide. Together, it could be a very, very vital and potent source that will not only inhibit platelet aggregation, that will also relax the vessel wall, and nitric oxide can be working throughout the body, including the new neuron synthesis, neuron activations, so memory can be much more, and muscle will get more oxygen and energy, so you'll get revitalize everything, and with the help of the fruit flow, then it has a proper kind of ambience that nitric oxide will be guided in the right place, right time. So this combination is very important, and all of these are water soluble. Because if you add some compound which is not water soluble, and they will be absorbed different times and different places of the things, it may not work. But this combination are all water soluble, absorbed very easily within hour, and they will work together in tandem like bicycle. And it will be a very potent because of this situation. And as I mentioned, nitric oxide, you know very well, those who are working in this, the guys got Nobel Prize because of the mechanism they found. But most importantly for us, that it does so many things. It is omnipresent, but stability is very low. That's why you need a continuous amount of arginine in the system so that nitric oxide can be produced in the body. And platelet will carry the arginine and others to different remote part of the body system so that it can produce nitric oxide. If it is not only endothelium is a static, is a tube system, but the platelet, along with fruit flow and arginine and tomato extract, these are nitric oxide flow around the body, including brain. So it will take care of whole body system, in addition to cardiovascular situation. And nitric oxide, as you know very well, it is involved in so many things. And by providing arginine, you are actually boosting nitric oxide production, and you are by giving tomato extract, you are giving antioxidants like catechin, etc., that actually induce nitric oxide synthesis so that the enzyme will be more, raw materials will be more, and it will be more mobile through platelets. So it can go to the remote system of the body and can make a vessel wall more expandable, more relaxation, and overall the whole hemostasis of the body will be more vitalized and much more energetic by this combination world ever known before. Okay, I'll not talk about this. So what I mean that the tomato extract and arginine combination, how it will work. Tomato extract, I know that it inhibits ACE, so it will lower the production of angiotensin II, and so lower blood pressure and vascular proliferation and platelet aggregation inhibition. Whereas when you give arginine together, that will produce nitric oxide and then produce cyclic GMP, and that will actually favor all these things that tomato extract is doing in platelets. If you don't have this, then we are ended up the bumpy road. This platelet become active and vessel is not relaxing, and there is a atherosclerotic plaque formation and narrowing of the artery, and that is atherosclerotic plaque. It can break and can produce cardiac events. So that your product, Live Extra Young. That contains, as far as I know, the most scientifically proven, documented, approved by the world authority that it does their job. And here is the combination. And this combination has a benefit. It is all water soluble. It can be absorbed together at a one time. It's not lipid soluble thing like EPA, etc., etc. They have a different way of doing it. It's important they are together. And this combination actually will go together. And then it will go to the target and the whole body. And with this, I'm ending my lecture, but if you have any question, anything on this.